Hi, welcome all. I am Dr. Binu Sasidharan, Specialist Orthopedic Surgeon at NMC Specialty Hospital, Abu Dhabi, UAE. Today, let us talk something about clinical audit. Clinical audit is a buzzword in healthcare quality circles. What do you mean by a clinical audit? Clinical audit is nothing but a quality improvement process. And the main aim of a clinical audit is to improve the patient care. And what exactly we are doing in a clinical audit? In a clinical audit, we are reviewing the patient care against certain set standards and criteria. And at the end of the clinical audit, if you identify that there is an opportunity for improvement, such changes will be implemented into the clinical setting. Every hospital should have its own system for clinical audit. What are the parameters to be audited is to be defined by the organization. Medical and nursing staff should participate in the audit. Of course, staff and patient anonymity during a clinical audit is always maintained. And the entire process of clinical audit is documented. Why do we need a clinical audit? A clinical audit helps in many ways. First of all, you will come to know how well the clinical care is provided. It also helps to answer certain questions. Is there any opportunity for improvement? Does the current practice meet the expected levels of performance? Such questions can be answered with the help of a clinical audit. A clinical audit helps you to keep updated with the evidence-based good practices in medicine. It helps the participants to identify and measure the areas of risk within their service. There is another benefit. Regular clinical audits will help to create a culture of quality improvement in the clinical settings. And last but not the least, a clinical audit offers an opportunity for increased job satisfaction as well. Now let's see what are the different types of clinical audits. There are mainly 4 types. One is the standard type. Second one is the adverse or critical incident related type. Third one is by peer reviews. That is mainly mortality and morbidity reviews. And the last one is by patient surveys. Although we consider all these as clinical audits, as per the current guidelines, only the standard type of clinical audit can be considered as the true clinical audit. Let's now focus on the various steps in a clinical audit. There are mainly 5 steps. The first step is identifying the problem. The second one is setting up of criteria and standards. The third step in a clinical audit is observing the current practices and data collection. And the fourth one is analyzing the data, identifying any opportunities for improvement and implementation of those changes. And the last step in a clinical audit is focused on sustaining the improvement. Now we will see what are the factors that can be audited. It can be structure, process or outcome. Avidis Donabedin was the first one to introduce these 3 terms, structure, process and outcome, into healthcare quality circles. We will see this in a little more detail. What do you mean by auditing of the structures? Structure mainly means the infrastructure, functioning of the equipments, availability of the staff, and so on. Then comes the auditing of the process. Process is the care received by the patient. That includes history, investigations, treatment, and how far we adhere to the current treatment protocols. And then comes auditing of the outcome. Outcome is the end result. That means what is a change that is observed in the patient's condition following a particular intervention. So that is the outcome. See, if you're auditing only the process, most of the time we will miss the end result. And if you're auditing only the outcome, you may not come to know how you reach that end point. So most of the time we need to audit a combination of factors. Now we will see the aims and objectives of a clinical audit. What do you mean by the aim of a clinical audit? what you try to achieve at the end of the audit, or why the audit is being carried out. If you try to answer these questions, the aim of the clinical audit will be clear. The aim should always be a written statement, and it's always good to phrase the statement in a very positive manner. For example, to improve the quality of care provided to diabetic patients. So that can be an aim of the audit. Now coming to objectives. Objectives are broad steps or strategies that need to be taken to achieve the aim. Objectives should be written down very clearly. They are very specific statements, and it's always better to avoid any abbreviations or acronyms while stating an objective. There should not be any ambiguity in an objective. And at times, a clinical audit can have more than one objective. I will tell you an example to understand these aims and objectives in a better way. To increase the proportion of patients with controlled diabetes. That can be an aim of the clinical audit. For the same aim, you can have multiple objectives. For example, ensuring proper medications, ensuring patient education for better compliance, ensuring counseling by a dietitian. All these can be objectives for the clinical audit. Coming to ethics in a clinical audit. Unlike in the case of a scientific research, a clinical audit do not need a formal ethical approval. However, ethical considerations should be given to issues like confidentiality and disclosure of audit results. In the next video, we will continue with Data Protection Act and second stage of clinical audit. So please subscribe to the channel so that you won't miss out on the next session of videos. And thanks a lot for the patient listening.